Surgicric 3 is a set to perform cricothyrotomy according to the Seldinger technique. The set consists of scalpel number 11, 10 ml syringe, 6 mm cuffed tracheal tube with dilator, neck tape, extension tubing, introducer needle with guide wire. Hyperextend the patient's neck and locate the cricothyroid membrane by palpation of the depression between the thyroid and cricoid cartilage. Stabilize this site with index finger and thumb and puncture the cricothyroid membrane. Check for correct position of the introducer needle by aspirating air with the syringe. Insert the catheter along the metal needle in caudal direction until the flange rests on the neck. Remove the metal needle. Attach the guide wire to the catheter. For depth orientation, there are graduation marks on the guide wire every 10 centimeters. Advance the guide wire to the 20 centimeter graduation mark. Hold the guide wire in place and remove the sleeve of the guide wire. Then, remove the catheter. Use the scalpel and make a 5 mm horizontal incision on each side of the guide wire. Railroad the tracheal tube via the preassembled dilator over the guide wire into the trachea. The pre-adjusted flange must be flush with the patient's neck. During this procedure, make sure to hold the guide wire at the proximal end. Then, remove the guide wire from the tracheal tube and inflate the cuff with a syringe to the minimum pressure required to seal the trachea and check the cuff at regular intervals. Unlock and remove the dilator. Make sure that the position of the tracheal tube is not changed. Ventilate the patient and verify for correct placement and successful ventilation by a suitable method at regular intervals. The neck tape is used for a safe fixation of the tracheal tube. Tracheal suctioning is possible through the connector of the extension tubing with a suction catheter of less than or equal to 16 French.